Once you are contracted and licensed and ready to sell, you will get access. There's no reason to give you access before that, because if you're not licensed and ready to sell with any carriers, it's not going to show up as anybody to sell. So you won't even see it in your dashboard. So this is the Connect4Medicare dashboard. If you'll do a, you can select a date range to run a little report of your completed enrollments, enrollment by plan type, all the profiles completed versus started. You can search for profiles previously created if you're looking for someone. And that's what we'll do right here. So up at the top where it says search for profile, if you just type in, a client's name, the first 3 letters, and of course you'll see all my test subjects here, which is me. And you can kind of look at their enrollment history, what's happened through that, for the client, if they've enrolled or not, where they're at in the enrollment process. You can export the list as a CSV file or a text file, but we're going to start fresh with a brand new enrollment. And you start that under Start Consultation. So this is going to be after you've done a compliant, phone. You can do this all at the same time, but you will have to conduct an actual appointment, whether it be compliantly over the phone, where you give all the information necessary, and you can send them information via email. All the required information will be on this platform. Or if you've already met with them in person or an event, and they've requested to enroll, you can do this remotely and not have to drive back out to the home. You can create a profile, send them a scope of appointment, and just start the enrollment process right away. So you can create a profile right here, and that's where we searched before. So we'll just go ahead and create a brand new one. I'm going to change it up a little bit, change the address. I'm going to work with some Utah addresses and stuff, so because that's where we're at, that's where I'm licensed, and that's where we will see some data. So under date of birth, we're going to make sure I'm eligible for Medicare. I will silence my phone, sorry about that. Let's see, we're turning 65 coming up in June. Okay. Simply hit continue. And I'm going to put in a different email address. All right. So it's very important that you need a scope of appointment. These scopes of appointment can be sent electronically, and that's what we're going to do right here. So you can do it by mail if you want, but the whole reason for this software is to do things remotely and by email. So I'm going to send an email to myself, email the scope of appointment, and it's been sent successfully. And we're going to bounce over to my email here where it says, thank you for your interest. I'm looking forward to meeting with you. Please fill out the scope. And you can complete the scope of appointment online. This is what your client sees. Once they click this complete scope, it takes them to the same website where they can, talk about, you can select what they want to talk about, fill in their information. And by clicking no, you're saying that they are the beneficiary. You're not acting on their behalf. And you've read and understand the contents of the scope of appointment form, and they confirm that the information is provided is true and accurate, and just simply click submit. Thank you, your scope has been submitted. We'll back out of that and go back to our, and all we got to do here is I like to continue and then go back. Kind of refreshes the screen. We'll go back to the profile. And as you can see, your scope of appointment has been populated. Here's the confirmation number that will be added to the actual application once you're ready to submit. Very easy, very quick turnaround, and you're compliant. So we're going to stay there. We're going to continue. Got to keep looking over at my other screen for messages. Okay. All right. Zip code. Under age 65. Good, fair health. If it has an asterisk here, that means it's required. But good health is, I don't even know why they ask for health status, because they honestly can't. But it defaults to good. It's going to ask about whether they qualify for a subsidy. Now remember, this is agent-led right here. This is the part where you're conducting this. You're filling this form out. And we're going to say that when I'm not eligible for extra help at this time. And it's really just moving forward. You can even select and find their drugs. This links to Medicare.gov, their drug finding tool. So if you want to type in some drugs, let's say we take simvastatin. Let's say we take celecoxib or Celebrex. Actually, we want the generic form. Okay. And once your drug list is complete, just click drug list is complete. It's going to bring you to a pharmacy finder where you can add pharmacies. We're going to select CVS because it's a half a mile away from where they say they live. All right, and here's your plans. So, very important to know that based on who you are contracted to sell and what zip code you put in, this is what's going to show up. So if I put in, let's say, a Texas zip code, nothing will show up in this area because I'm not licensed to sell any carriers in Texas. If I plugged in a Portland zip code, sure enough, whatever is in Portland would show up because I'm licensed to sell in Portland. But I put in a Utah zip code. This is what brings up in Utah. The 2 Humana plans that we have, the 2 United plans, and Aetna's got a few more. And there's a couple with all of them. So you can, if you know the plan that you're looking for, you can go ahead and find it and click enroll. You can compare a couple side by side and break down the benefits once more in front of your client. You can find there's a pharmacy directory right there. It tells you all the drugs are covered. The 2 drugs that we put in are covered under this plan. Same with the other one. If you want to find a doctor, the doctor directory is located right there. It takes you right to them. So if I click on physician directory, it brings up another screen, and you can start looking for your doctors on the Humana network or United Healthcare. It takes you to WeRally, and you can find your United doctor. Very, very user-friendly, simple, gives you your co-payment breakdowns, drug breakdowns. And you can even expand it to do more detail. and your required documents that you need to leave behind in any appointment. Yeah, that's why I said that if you saw the beginning where it did not have an asterisk, you don't even have to ask them that health question, because it's not relatable. I don't even know why it's there. I don't have access to remove any of the questions on this platform because it's software that we pay for. But it's just there and it defaults. But you are correct. You cannot ask a client about their health conditions in a Medicare Advantage. All right. So, like I said, the required documents, you got your plan, your summary benefits, an actual enrollment form, a checklist, star ratings. But we're going to go back to where we were before. And after you've done a little bit more, comparing, contrasting, whatever, you find the plan you like. You say, this is the plan for me. I want the $32 premium United Healthcare, and just click enroll. It's going to give you a notice that says you'll be redirected to the carrier's form to complete this enrollment. So now everything's going to be United Healthcare branded at this point. And here's your brand up there for the plan. Once again, a link to your required plan docs. And I believe Humana actually has quite a few other links as well. Humana does everything in Spanish and English, which is nice. But unless it's a Spanish plan, it usually will only show, what the plan documents are that you've selected. So you just continue to fill out your information. Everything's good there. We'll continue. And I'm only going to go so far because this is a live environment and I definitely don't want to submit a fake enrollment to the government. That would not be good. All right, emergency contacts, optional. Medicare information, it's when you key in their Medicare ID number. Oh, I'm sorry, that was the wrong one. Your name as it appears on your Medicare ID. Then your Medicare ID number. Effective dates. We said we were turning 65 in, was it June? Right. Okay, we are new to Medicare, and you've seen this type of verbiage in most applications. I believe this is kind of what Aetna uses for their applications, and they just copy and paste it from CMS guidelines, I'm sure. But new to Medicare, these are all your enrollments. Why are we enrolling you today? If you have an SEP, if you're part of OEP, that's a new one on there now, which just ended. And it says if you have a premium, let's find out how you're going to pay it. This plan does. And we're going to ask for a Social Security deduction. And no, we do not have any other coverage at this time. If you did, you just select yes and type in the coverage they have. We're not part of a long-term care facility. We do not have end-stage renal disease, and I'm not enrolled in Medicaid. No, we're not working, and this is where you would, since this is, we do need physician selection. At this time it says it's optional. If you choose most HMOs, will require you to do so. So once we found a doctor, put in their physician ID, and you can actually find it right here as well. All right, and then we're just back to reviewing the information. This is the attestation. I'm the Medicare beneficiary listed on this enrollment application, and your beneficiary can, if they're with you in the office, they can sign right here, or if they're not, and this is a phone, you can just type their name in, select due to physical limitations, not necessarily because it's an ailment, it's just they're not physically with you. You can just type the name in right there. And you will submit the application and you will get credit for that app. So I am not going to go that far, but we wanted to go back and show you a few more things here. All right, actually I'm going to re-log in. So now I'm going to show you what your client will see if you send them the application to fill out on their own. And from your dashboard, you can just select Send Quick Quote. Key in the zip code. So once you've discussed plans with your client, you can say, I'll go ahead and send you a few things to review. Come back in here and select the plans that you want to send to review. And you can send up to 3. This is kind of what your client will see. And you're going to want to send the multi-plan quote. You can change whatever message you'd like right here. This is kind of a default message, but you can make it say whatever you'd like. And this code, so your client's going to get 2 emails. They're going to get an email saying, I have this quote for you, and the next email will be, here's the code to get into the quote. So let your client know that they will receive 2 emails. And I'll show you what that looks like. Information has been sent. Let me go back over. Okay, so there's the two emails I spoke about. First one is a welcome. I have a quote for you. Thanks for meeting with me. Here's a quote that includes plan or plans that I think fit your needs. They hit view quote, and even if you forgot to tell them about the second email, it's going to ask. You should have received a separate email with your authorization code. Please enter in that to find the details. So you simply go back to your email, click on the other email, and there's your code right here. Just copy and paste it in. Your information will be up top as the broker. So once they actually complete the enrollment, you will get credit for that and become their agent of record. Come on. That was the other one. There we go. And they're going to see the same type of information you saw. They can edit their own information. They can add their own medications, add their pharmacy, and then they can actually expand this and see all the plan details. Or I like to click this. It's a little too small. I wish it was bigger, but it says compare these plans. And then it'll be very similar to what you were seeing as the agent. They can look up their own doctors, tells you what their star rating is. They can come back, they can create an account and come back later. It's very, very user-friendly. If they want to look a little bit further at one particular plan, let's say Humana, it'll break it down for them. Very, very cool. It gives you their EOC, the multi-language insert, non-discrimination insert, your stars rating, summary of benefits. This is all the required stuff that you need to leave behind. And it's just a simple PDF that they can actually save to their computer. So if you ever need materials, you can print it off here as well. Benefits at a glance. I do like this. Oh, that's the EOC, sorry. This is kind of a quick hits. If you ever looked at the Humana plans, these are really easy to go through. All right. And if they like that plan, they simply click enroll and follow the directions. And it'll go through the exact same thing that we just did. One last thing is, once you're, I don't know how many agents on here today have established their own websites. But what I like is, once you log in, let me get out of here, sorry. All right, so once you log into your Connect4Medicare, you can go up here to where it says My Account. And this is where you can change your information, change your password. But what you really want to have is access to this unique URL. This is a link that you can embed. As you just click the copy, it'll copy this link, and you can take that and embed that into your own website. So if you have a Medicare landing page, and I'll show you our website, or one of our local websites here where I've done that. So this is a local website here that I use sometimes for a lot for training. I do have, this is client face, this is live, so my clients can go on here and look, and I kind of help people, with website content and whatnot. So under the Medicare tab, after it breaks down what Medicare is, you can actually hit the quote and enroll. And this isn't, I just did this just to show you how it would work. But under this button is where I embedded that unique link. So if a client was shopping through my website and I hadn't even spoke to them, they just happened to land on it through whatever marketing direction that I took at the time, whether it be Google AdWords or Facebook or Instagram. Somehow my client landed here and they decided, yeah, let's go ahead and enroll. They click that link and it takes them right to Connect4Medicare, where they can get started, start shopping. If they already know the plan they want, they can hit enroll now, and it takes them right through what we've just talked about. So, and even if you haven't even spoken with them, it's 100% compliant to get that business. You will be credited as the agent, and heck, there's no scope of appointment even needed because they came to you. So that was a very quick run through. Any questions that people may have on the Connect4Medicare platform? I'll kind of unmute folks here. Looks like we got about 34 folks online here.
Have you ever sold a plan that you never talked to in person, where they went to your website and then they just ordered without any input from yourself?
Yes, that has happened. Mostly on the dental side of things. It has happened a couple times with agents with the Medicare, but I like to do that with a dental plan as well, because I hate selling dental, and I'd rather just have people enroll themselves and me get credit. So, but yes, it has happened. Agents here in Utah use it quite often. There's an agent in, I believe we've got an agent in Michigan or Indiana that uses this all the time, and that's where he gets most of his enrollments from, because he has such a big following with his own website. So someone once asked, do I really need a website? Well, that's up to you. It's how big do you want to get, really? But if you meet with someone and they leave your office or the appointment, especially these new folks turning 65, they're very, very much more savvy computer wise than their predecessors, and they will Google you. They will try to find out about you. It's happened. So whether you just have a LinkedIn landing page, because that's one of the first things that show up in Google, or if you have your own website, there's a very good platform I like to tell people about, as far as just it costs like $150 a year, and you can actually be registered as a Medicare supplement specialist in the area. So if someone's looking for a Medicare supplement, they key in their zip code and your name shows up. It's really neat. We can talk about that offline. How does it link your website to when you switch over to the Connect4Medicare site? Do you show up as a servicing agency, or do they call Medicare directly? And it's just the URL. So it's a URL that's dedicated to your website login. Yeah, I've actually done a screen share enrollment, Jeff. That has happened. You can do that. You can actually do a video, an enrollment video. Humana has a really nice, really concise enrollment video that you can share, and it's compliant to do it remote. It's compliant to do it with a screen share, absolutely. Someone's asking, how do we get the Connect4Medicare? How do you get to the Connect4Medicare screen? No. How you get there is on our website. There's a link. Let's show you here. So under Tools, yeah, you have to actually it won't let you log into Connect4Medicare unless you're licensed with carriers and you've requested access to the site. So if you're trying to log in right now, it probably will not work unless you've already been granted access. All right, so under Tools, it's just right here under Connect4Medicare. Our website is agent-boost.com. So we're just taking questions at this point, guys. There's nothing further as far as training that goes on, anything else I have left to talk about. So if you want to stick around and ask questions, that's no problem. I will be here. But thank you for joining. We're going to go ahead and end the actual training side of things, and now we'll just answer questions. Someone asked how to request access. That will come to us you will submit an email to your dedicated rep. So once you've been onboarded, you should have been introduced to your dedicated rep, whether it be Alex or Nico or Mike or Gina or a couple other folks over here. And you'll send them an email saying, please, I'd like to have Connect4Medicare. We'll kind of do the back office work, make sure you're licensed with at least 3 carriers with us to get that. Ready to sell and licensed with 3 carriers. And if you're not sure who your contact is, send me an email, Brian@agent-boost, and I will take care of it.
And will they give us a username and password, or do we create that?
You will be assigned one.
Okay.
In order to use, my directives have been, in order to have access to the Connect4Medicare site, we'd like you to have 3 carriers with us, but we'll give you access to our website just by being contracted with us. Just going to email. Okay, kind of an off question here. Someone says they just got certified with AHIP. It's called AHIP instead of HIPAA, although HIPAA is a thing as well. But AHIP is the national test that you take. So what you do with AHIP, and I can show you on my screen here. So let's hang on a sec. So you can go back into the Aetna site that you say you took your AHIP on, and that's where I'm going to go right here.